Today we are going to discuss the pathophysiology of a concussion for the audience of a teen physician. A concussion should be described as the results of a force being transmitted to the brain. Now, this means that a concussion can occur in the absence of direct trauma to the head, neck, or face. This mechanism can be both direct or indirectly. We then want to discuss coup versus counter coup. Coup is when the site of impact is the location of the injury, whereas counter coup is when the site of impact is on the opposite side of where the injury occurs. Now, a concussion can be described as a neurometabolic cascade. This is a cascade of ionic and metabolic dysfunctions that is associated with axonal injury. Neurotransmitters in the absence of injury are released in an organized manner, sending coded messages from one cell to the next. When the force is transmitted to the brain, resulting in a concussion, there is a release of potassium ions from the cell, which results in an increased demand of glycolysis. Following this release of potassium ions, calcium ions enter the cell, which results in a decrease of cerebral blood flow. This cascade leads to a metabolic crisis where the demand for energy is increased and the neurotransmitters are released, disturbing communications between the cells. Given that there is a massive release of these neurotransmitters, the communication is disrupted and not done so in an organized manner. At this point, the nerve is in an extremely vulnerable position, and any further harm can lead to death or serious damage of the neuron. This being said, it is very important to properly evaluate the patient and ensure that they are removed from participation so no further harm can be done at that time. Once the injury has occurred, the cells take time to return back to normal. This time is dependent from each individual and each different patient. It is very important to individualize specific rehabilitation and treatment for every individual who has a concussion, given the time of return to play is different for each individual.